Hi, everybody. Good morning, good evening, and good afternoon to each and every.
Oh, Wendy, you're muted.
Wow. Thank you. Good morning, good evening, and good afternoon, everybody, and welcome to the Personal Development and Training. Today, we have I have a special guest for you, and we have a special topic at hand. So our topic today is heart health. So heart health is so important to each and every one of us. Heart disease is the number one condition that takes us out of this wonderful experience that we call life on this little blue dot. And it is the number one, yes, killer, but it's even gone exponentially even greater so with even other age ranges in the last couple of years due to different events that have on our play within our world. So what other better person to bring onto this beautiful platform to talk about his experience, his knowledge, so that we can all gain from it, but also what can we do to help ourselves? So everybody, could you please give a good warm welcome to Dr. Jon Harmon. Dr. Jon Harmon, hello, how are you doing?
Hi, Wendy. I'm really excited to share this information with you. It has been a life changer for me in my journey on this little blue dot. And so it's very, very important. Number one killer, obviously. So I have hopefully some good information for you. I think it's really good information. And more meaningful to me is that it's something you actually implement in your lives to help your family, everybody actually not go into this slow decline towards frailty and disability or early death. And so there's a lot of information in the book that I wrote. There's a chapter that's specifically on cardiovascular health as far as how the GHK copper peptide affects us and affects different aspects of cardiovascular health. So I think I'll just dive right in. Wendy, is that okay?
Yeah, that's great. And everybody get your pad and paper, and your pen, and write down any questions. We're going to take the questions at the end, and only questions that pertaining to the subject at which Dr. Harmon is going to be covering today. So take it away, Jon.
Great, thank you. All right, well, let's talk. In order to really understand how powerful this is and how important it is with the GHK carbon peptide, let's look at some of the things that cause us to get problems in the heart. First of all, before I start, I want to say I am a doctor. I'm not your doctor. So I'm not giving any medical advice. And when I'm talking about my experience, your experience may be different, but I'm going to tell you mine, and it's documented through 2 different stress echocardiograms. And I'm not making recommendations. And anytime you start any kind of new protocols or regimens, you should always consult with your healthcare practitioner. It is one of my goals to help people get out of the disease management system that we have. We don't have healthcare in the traditional way that the powers that be actually dictate. And I'm working very feverishly to help people get out of that system for a better life, a longer life, a healthier life. So let's look at some of the things that cause our hearts to have problems. The number one killer of people globally is cardiovascular disease. Let's talk about stroke. Stroke is what? You got a clot somewhere, and now the blood can't get to the other side of where the blockage is. In order to understand that, we must understand that we have in our system, it's there, it's on purpose. We have a substance called fibrinogen, and that makes our cells a little bit sticky. Why does it do that? Well, if you get a bleed, if you get a cut, you have to be able to clot. You have to be able to stop the bleeding, but you don't want to have too much because then the cells get too sticky. And then the more cells that stick together, the bigger the clot. And then it's big enough to block off, a little capillary or an artery, something bigger. And now it's a problem because now you can't get oxygen to the other side of that blockage in that vessel. The number one indicator of being predisposed or set up for a clot is a high fibrinogen level. Once you know that, and once you know the study that was done on over 5,000 men in Sweden over a 10-year period, and they found that the number one predictor of stroke was high fibrinogen level, and you were just under 2.5 times more likely to have a stroke if your fibrinogen level was high. Coming back to why we're talking about this today, what does the GHK copper peptide, what kind of an effect does just in that one thing specifically, what kind of an effect does it have on our fibrinogen level? Well, it doesn't do anything abnormal, but the GHK activates, actually inhibits a gene that's involved in producing part of the fibrinogen molecule. So it prevents, it's kind of like a governor, it prevents an overproduction of fibrinogen, thereby helping our fibrinogen level stay down more within normal limits. So that's one. What is the other cause of cardiovascular disease or death? That would be an MI, myocardial infarction. So let's talk about that for a minute. What is that? Well, I couldn't get enough blood flow into that part of my heart, and I didn't have enough oxygen. Therefore, that part of the heart is not going to function anymore, and it stops. So when you understand that, and when you understand that it is the GHK copper peptide that acts like a Pied Piper to attract endothelial cells, which are the cells that make new little capillaries, little vessel growth, they're involved in that in several different ways. One, when we are either working out or when our heart is working and there's a decrease in oxygen, the normal process is this. The deprivation of oxygen induces the body to make a substance called hypoxia or hypoxia inducible factor. That's what it is, HIF. And you don't even have to know what that is, but basically what it says, it's like an alarm. It says, hello, we need a little more oxygen down here. Could you send us in some capillaries? So with that HIF, your body gets the message, there's not enough oxygen here. I need to grow some more vessels into it. And that is true whether it's your heart or your muscles and you're working out, you're trying to build muscle. It's the GHK copper peptide that starts the process of getting more vascularization or more capillaries into that muscle that you're trying to build. It's also there to help you build that muscle because it's a collagen builder. I meant, collagen. So when we are working out, we get a deprivation of oxygen because you're doing all those reps, right? I can do 12, I can do two more, oh, then I fail. Well, your body tells or starts that process of that hypoxia inducible factor 1. That sends a message, bring in the GHK, and also the cells that are located where it's needed, they start to produce something else that then they're enzymes that kind of break into the protein of the muscle that you're going to be growing these capillaries into. They poke little holes, and then the little endothelium cells can migrate in there and then make new capillaries. Isn't that cool? So there's a system that is supposed to be there in our bodies to make sure that our muscles, including our heart, have enough oxygen flow so that the muscle doesn't die. So that's one. And so there's the other part of heart health, and that is when I got a little bit behind. I mean, ahead of myself. So we have the situation, we don't have enough oxygen, and now I need to get capillaries into that muscle, that heart muscle, so that I have enough oxygen, so that I don't have an MI, so that I don't have that plaguing me the rest of my life. Now, is it best till you have a symptom that you can monitor so that you can say, check the box? Yeah, the X39 is really doing something for me because I can feel something happening. We're so accustomed to drug effects of something, a drug. We take a pain pill and it blocks the pain, whereas you're not going to feel when you have little capillaries growing into a certain part of your heart or your muscles. You're not going to feel that system, and there isn't somebody shouting, okay, I'm sending down more of this. This played out for me when I first started using the X39 and elevating the GHK copper peptide in my bloodstream. We know that LifeWave did a study, and that was measuring, it was a double randomized placebo-controlled study where they measured the blood of the participants. They drew a tube of blood, they measured that, they flash froze it, they measured the GHK copper peptide, they did it at intervals during the trial. Everybody who was one of the participants had a huge increase in their GHK copper peptide in their bloodstream, especially as opposed to the control group. So LifeWave already proved that. So I don't have to, and you don't have to really prove anything about the patch. Patch elevates GHK. In order to determine any potential benefit from wearing that patch, one just has to turn to the literature. And when I first started, I feel like I was the one who really wanted everybody to understand what the GHK copper peptide does. So I did 3 different PowerPoints over a 3-year period. And then I decided, you know what, this is frustrating trying to get all this information. So I put it into a book, basically a reference guide to everything GHK and AHK, where you can look something up. Well, I was oddly attracted because I was doing the research on trying to put my PowerPoints together. I was oddly attracted to the organ function study done on the LifeWave X39, but I was oddly attracted to the cardiovascular report starting out. And I say oddly because it was kind of ironic. I didn't know I had a right bundle branch block at the time, but I was attracted to that, probably because I had a couple of warning signs I'll tell you about. I did not know, I didn't have a diagnosis or anything. So the study, it was a 6-week study, and they did all kinds of measurements on the cardiovascular systems of the participants. After 6 weeks of wearing the patch, the cardiovascular systems acted, is another way of saying reversed age, acted 2 months younger. So I did the math. For every day you wear the patch, your cardiovascular system will act a day and a third younger. At 4.5 months of using these, I already had a knee replacement scheduled in August of 2020. Started using the patch in April of 2020. At 4.5 months, the PVCs that I had my whole life, and I had them when I was younger, I just didn't realize what they were. My heart felt funny. And the doctor always said, yeah, he has a heart murmur. When my mom would take us to get our physicals for school, yeah, he has a heart murmur. I wonder what that is. And they started getting really rhythmic. Prior to that time, they were totally random. Sometimes none, sometimes, every 2 seconds for maybe 1 beat. And then it was 17, then it was 20, then it was just totally random. But they got really rhythmic every fifth beat, every day and night. And I'm thinking, I don't know what's going on, but I got this knee replacement surgery coming up. I need to make an appointment with a cardiologist, and I'm so glad that I did now. So he did a stress echocardiogram, and he came in and he said these words: Heart really responded well to exercise. I wanted to say, I knew that. Why I was a long distance runner. My heart felt better when I was running because I didn't have that symptom. And he said, you just have these PVCs and a right bundle branch block. And I said, well, what causes that? He says, well, in our entire body, we have cells that have to be killed off. They're old, they're sick, they're dying. The heart doesn't heal well because it's beating, and it usually scars over rather than replacing something. And I went, aha, I think I know what's going on here. I've been increasing my stem cells at such a high level that it's replacing what needs to be replaced, and they don't know how to beat, and they're all misfiring at the same time. That's the thing that went through my mind immediately. I have no proof of that. You can't quote me on any literature. It's just, it made sense to me. 2 weeks later, the PVCs were gone. And then fast forward about a year and a half, I had another stress echo done. And then I got the report back that the report said right bundle branch block no longer present. And then I got the little thing on my, it's my chart app. Dr. Ryder has reviewed your report, and he's happy to tell you that there are no issues reported. Everything looks great. Okay. So the things that went through my mind, because I had the warning signs I was telling you about before. I was sitting writing chart notes in my office, and all of a sudden, everything, it's like the screen went black. And for about a second, I just blacked out 2 different times. You know, typical guy, never happened again. I'm good. Must be nothing wrong. Just total coincidence. But now to not have that is a big deal for me and my family. So I tell you that, not saying it's going to be your experience, but that was my experience, and it's life-changing for me, my wife, my 10 kids, my 26 grandkids, different life, different grandpa, productive, not slowly declining into this frailty and disability, I call it, healthy, vibrant, vigorous of life. So that is one of the things I can't guarantee, but to elevate your stem cells, there isn't any research about that, about hearts. So you're not going to find anything about that. I found something, personal experience, but you can't look that up somewhere and say, hey, if you increase your stem cells every day, then what's going to happen? They're basing the things on previous history of medicines. So they don't know what's going to happen. And so I tell people, had I not had that first stress echo, I never would have known I had a right bundle branch block. And then I wouldn't have had the second stress echo. It would have gone away. I wouldn't even have known that I had it, much less that it went away. So when you are trying to evaluate whether or not the GHK copper peptide is really doing you a lot of good, just remember, unless you're measuring everything in your body, kidney filtration, liver function, bone density, your blood panel, all of those things, you might not notice things that are changing. Okay, how else does the GHK affect the cardiovascular system? It's repair of the collagen that our vessels are made of. What happens if you have weak blood vessels that have low strength and low elasticity? That's called an aneurysm. If your vessels are weak and they can't take the constant expansion and contraction all day long, then they form these little outpouching, or they get a split between some of the layers of like your aorta, and they call it a dissecting aneurysm. Can I promise you that you're never going to have one of those? Nobody can. But if your vessels are weak, you're much more likely, there's a high probability that you're going to have something like that. Why not just keep everything healthy? That's what I say. It's the way I was raised. I remember my mom, a whole handful of vitamins, a tablespoon of cod liver oil, and her green drink. I don't even know what was in the green drink. I just know that I could taste cod liver oil in PE in third period because of burping it up. In fact, at her funeral, I wrote a poem for her funeral. One of the lines was, So drink your green drink, freshly blended. Just plug your nose and it tastes splendid. So that was our, one of my memories of my mom is that whole, I thank her now, but back then, Mom, why can't we have soda and donuts? Well, I thank her now. Okay, a little diversion there. All right, so let's do a little review. GHK copper peptide helps keep fibrinogen levels at normal levels. So it helps prevent or decrease your risk of having a stroke when your cells are too sticky and they stick together and you get a clot. The other thing that it does, it increases, this is the GHK copper peptide, increases the production of myostatin. Myostatin inhibits heart failure. So you get that on two different levels there. Increases myostatin, decreases overabundance of fibrinogen. And when you talk about it being a big antioxidant and reverses the oxidative stress that we all go through, the body, heart beating, I mean, that's like damaging everything every time it beats. It has to constantly repair that. Whether it's the collagen, whether it's the elastin. The elastin makes things stretchy. You have the collagen matrix, and then you have the elastin. The GHK is essential in the production of both of those and the repair of both of those. So those are some of the key benefits with heart health. I have a slide. I want to let me make sure it's open to the right one. All right, I'm going to do a little screen share. This is from a presentation I did for the group into the Evolve team, and then at the Energy Healing Conference in Utah. So this is a slide. Let's see if I can get it. There we go. So our number one killer, high fibrinogen levels, number one predictor. I already said that you're almost 2.5 times more likely to have a stroke. Decreased oxygen in the heart muscle causes myocardial infarction. So then I go over, what does it say about it? We went over this, keeps fibrinogen levels at normal levels, increases myostatin, which inhibits heart failure, helps new blood vessels form to promote proper circulation. Okay, so if there's another, that's all I wanted to show you on that. Now, we're talking about heart health. We can't leave out carnosine when we're talking about heart health. And so I want to talk to you about how carnosine benefits the heart. And there have been animal studies and human studies done. Animal studies, carnosine helped with blood pressure regulation, so lowering blood pressure. It helped with heart rate, keeping the heart rate down within the normal limits. It doesn't abnormally lower your heart rate. It helped with blood pressure, heart rate, but it's also essential in the proper formation of not just the heart, but many other organs, kidneys, and other organs. So that's what carnosine is good for. I actually have a little note. I want to grab it right here. Excuse me 1 second. I wanted to make sure that I got I listed all the things. Oh yeah, reduce weight. So you wouldn't think that that has anything to do with directly to the heart, but it does. It helped reduce the weight, and it helped develop it inhibited the development of atherosclerosis. This is the carnosine. So this is all obviously very, very important for heart health. It opposes glycation. And when you think of glycation, think of caramelizing sugar. What happens to it? If it's dissolved in water, it's not such a big deal. But when it's caramelized, it's hardened. So that's glycation. And it actually helps prevent glycation. And it induces proper development of the muscles, the heart, the kidney, the brain and many other organs. And that's why David talks about it being so beneficial for the brain. So it's yes, definitely needed and beneficial for the heart, but we make carnosine in the brain, the heart, and the muscles. So think of it, those are the organs that are going to need it the most. And the heart uses so much of our glucose stored because it's constantly beating, and so does the brain. So we have to prevent the glycation end product of that, and carnosine helps do that. So carnosine helps so that those deposits, those protein deposits, don't build up in the brain. And so that's what David talks about, where someone, as we age, we lose about 9,000 neurons a day because they're old in the brain. And I've read different reports anywhere between 2,000, we only replace 2,000 to 4,500 or 5,000 of them. So there's still a net loss of about, even at the high end, 4,000, 4,500 net loss in brain cells. So if we, in addition to that, have the buildup all of this gunk in the brain, our brains don't work very well. So the important things to remember about heart health: helps prevent fibrinogen buildup, which then indirectly helps, so we're much less likely to have a clot, which would cause a stroke. Helps our vessels stay strong and healthy, good collagen, good elastin, flexibility. It's nice to have arteries, but if they can't expand and contract through, good elastin, then they're going to be much more likely to have some kind of a tear. That would be an aneurysm or a bulge. Then the fact that the GHK copper peptide is essential in that new capillary growth into tissue where there's sensed a decrease in oxygen level, hypoxia. Hypoxia inducible factor 1 is what the alarm goes off. The body says, hey, there's something going on here. I need more capillaries. I need some workers down here. I need some endothelial cells right now. I need some enzymes to dissolve, make some little holes in that protein matrix of the muscle. And so the endothelial cells can kind of squeeze in there and start making some more capillaries. So that's how it happens. And if you think of bodybuilders in that context, when they're getting judged on their muscularity and their symmetry, they're also judging on their vascularity. Look at the huge veins on his biceps right there, and wow, the vascularity is incredible on that guy. Well, it starts with the GHK copper peptide. So there's a lot of talk about, they don't have really great studies on it yet, that GHK is involved in actually building muscle, because it starts if you're trying to build muscle, you can't build it unless you have a freeway of nutrition going in to build it. And it's GHK that helps with the collagen, building of the collagen, but it also helps induce those capillaries to grow into that to support it. You have a bigger muscle, you need more capillaries. It starts with that, with the GHK, and then you get those huge veins. I mean, you get those huge veins, like Arnold.
Well done.
How much time do I have? Do we have time?
You're doing good. Yeah, like another 30 minutes. So let me go kind of recap, and because in my head, right, I've been programmed, and I think that's a really, really good place to start. We've been programmed so much that, heart disease, what it comes down to is cholesterol. But I have a funny feeling, and correct me if I'm wrong, cholesterol and fibrinogen are really closely related in the way it's really the fibrinogen that's clogging things up because everything gets sticky. Yes or no?
Well, I have a little story to tell you.
Tell me away.
The whole thing about cholesterol being blamed for everything was based on a flawed study called the Framingham study in the 70s. The entire anti-cholesterol, the statin, the entire narrative was based on a flawed study. There were two famous cardiologists. I don't know if it's still available online. It's probably being blocked. But two of the most famous cardiologists in the world were on the Dr. Oz show. And they said, blaming cholesterol for being the cause of cardiovascular disease is like blaming the fireman for starting a fire when he's there putting it out. So here's the rest of that story. 70% of your brain is made of cholesterol. Your skin needs cholesterol. You need cholesterol to make sex hormones. So if you want to be impotent, if you want to have low testosterone, low estrogen, or any other hormone, whether it's insulin, just shut your liver off from making cholesterol, because that's the substrate, and then things get attached to it, and now that's testosterone. So now we're shutting your liver off. Why would you think that the liver would do something that's not necessary? Would it start making cholesterol as a toxin? No, cholesterol is a very necessary substance. And so if you want to go into severe cognitive decline when you're older, take as much cholesterol statins drugs as you possibly can. And if you want to have all kinds of health problems, make sure you take a lot of statin drugs. I'm being facetious, obviously. I'm not. I've told my patients this for more than 30 years. And they look at me like, my doctor said that I need this. Some of them took it anyway. But I saved people from the terrible consequences of blocking your cholesterol production. People would come in and they say, man, I don't know what's going on. I have these muscle aches everywhere. My joints hurt. What have you been doing? Nothing. Did you start taking statin drugs? Yeah. It causes joint aches and muscle aches. There's a reason you need that cholesterol. So, okay, I'll get off my soapbox.
No, that was a beautiful soapbox because people need to hear it. I remember my mom, when her cholesterol levels were going up, right? They put her on statin drugs, and hindsight, she immediately started researching and found out that statin drugs also prevent vitamin K uptake, which therefore could create calcification in the valves. So she stopped the statin drugs, but unfortunately, too much calcification happened in the valve. She had to have a valve replaced, and hence her heart disease began. So it's a very important topic to have. So thank you so much for going down that rabbit hole of us being program guys. It's all program.
Yeah, especially when the normal cholesterol level accepted in the medical community was 260.
Yeah.
And then all of a sudden it's 220, and then it's 200. It's they're recommending kids get put on anti-cholesterol medicine. Why would my liver be so stupid if I'm 10 years old that it's making cholesterol that weren't really good for me? I mean, it's
Yeah, it's horrific.
I don't buy into that stuff.
Yeah. So we talked about the importance of GHK not only with helping make fibrogen your cells less sticky, but also help increasing the myocardial infarction, the hypoxia, increase the myostatin, correct? Am I saying that right? And then also carnosine, as we have the carnosine product that helps increase carnosine within actually your body starts making carnosine, so it helps with the muscle of the heart. So why is it so important to keep that muscle strong? I'm sure there's other things that we need to do, yes?
Regarding the muscle,
heart. Yeah,
the heart exercise.
Yeah. That E word, right? But
Yeah.
guys, it's so important. Now you're not talking about going out in the gym and hitting it for 2 hours.
No, not necessarily. Everybody's at a different level. You start where you can. If it's walking and that's the only thing you can do, walk. That's really beneficial. In fact, when you're older, it's harder on you to run, and sometimes dangerous. Trip and fall, or running out on the street. But walking is so good for you to get the heart rate up, get the blood pumping. Our calf muscles are pumps. The blood is no longer under the pressure of the heartbeat when it's trying to get back up. So movement in our calf squeezes the veins and the lymphatic system to squeeze that point. A lot of it's not necessarily blood, it's lymph, it's things that oozed out into the tissues, and your lymphatic system picks it up and it has to get back. It's allowed to pool down in the lower extremities. A lot of bad things happen. You get stagnation, and you don't have good in and out of the nutrients that you need, oxygen. And then if it's bad enough, then the nerve endings will start to die because they're not being nurtured, and they don't have the nutrition, they don't have the oxygen. So getting up and moving, even if it's on one of those little mini tramps, if that's all somebody can do, that's actually a really, really good exercise, because every bounce, those muscles are contracting, and it's getting that excess fluid back into the heart so it can go back into circulation.
Yeah, the rebounder. So everybody, it's easy with your joints. It's fun, and there's a lot of benefits from that. And for those of you that can't get out because for whatever reason, due to the weather or because your lower extremities aren't doing well, there's a bicycle you could get for your upper body, and to go ahead and work up that heart strength. Just like any muscle, if you don't use it, it atrophies, it decreases. And is that the same way that happens to our heart itself, even though it's beating all the time?
Well, it's beating all the time, but it has to be able to take that load when needed. Mm-hmm. Heart also, most of the time, if there's damage, it doesn't heal with, like the rest of the body, it heals with scar. And that's what they found with the thing that's been going on around the last 3 years, is that if, well, probably not best to get into that right now, but if we have,
if you don't, I will.
Well,
Dave Schmidt did bring it up.
Unfortunately, healthcare practitioners were told not to aspirate with that shot, mm-hmm. because they didn't want to create vaccine hesitance. So if you have to withdraw the needle and then push it back in, if you're in a vein or an artery, you're supposed to aspirate to see if it sucks blood out. But if you do, then you're in a vessel, and you either got to go deeper or shallower. And they told people not to do that. So they just went in and injected. So if they were in a vessel, you get this huge bolus of the contents in the syringe, and then it gets into the bloodstream. And the damage that has been occurring has been dependent upon where that went. So if it went into your heart and caused the damage there, then you get a scarring of the heart. And now if you're a high performance athlete, and all of a sudden you're out on the field and you go from 0 to full speed in a soccer game, these are the high performance athletes who have died. And it was because of the scarring on the heart.
Wow. So sad, so sad. So kind of staying in that, quiet shadow area, what can one do food-wise or, detox-wise to help fortify their heart to improve from the current environmental factors that are currently facing have faced a lot of people and are still facing those same people?
Well, a lot of those things are covered with LifeWave patches, not the nutrition portion. Keep in mind that vitamin C is necessary in the process of making collagen. You have to use you have to have vitamin C. I used to tell people when they come in with a whiplash or something, I would have them take at least 3,000 milligrams of vitamin C to help your body with the repair of all of the ligament structure that have been damaged in the muscles. So obviously you need that. There are lots of things, and we should probably have a different one about proper nutrition for the heart, because we wouldn't do it justice right now. But, some of the things that we can talk about in the last few minutes, somebody's asking about fibrinogen level. Does the X39 decrease fibrinogen level? Probably weren't on at the first, and it doesn't abnormally decrease fibrinogen level. It just affects there's a little gene that controls the production of part of the fibrinogen molecule, and the GHK inhibits that gene. That was
Okay, great. Yeah. So if you're okay, good to segue into questions here that we've seen in the chat. One of the other questions is what is your recommendations if there's too much plaque in the arteries?
Well, the carnosine, that's actually one of its roles, is preventing that from being unstable. So it inhibited the development of atherosclerosis. Carnosine did in these studies.
Yeah.
So, but it also helped prevent that from being unstable and throwing off little chunks. In the study that was.
That is beautiful. That is great news right there. Another question.
Throwing off chunks now, do we?
No chunks thrown off, please. Another person asks, why do you feel that David says it's very important to do squats?
Well, first of all, those are the big muscles, the glutes, the thigh muscles. And once you hear the following sentence, you cannot unhear it. And this is what actually motivated me to finally have my right knee replaced. I was at a conference, and the instructor, it was a CE course, and he said this. He said, the number one last tripwire that sends someone into nursing care is the inability to squat your own body weight. Why? You can't get on and off the toilet. Your partner is old too, and she or he can't lift you. And you can put up with somebody forgetting stuff. You can put up with having to feed them. But if you have to change an adult's diaper, it's off to the nursing home you go. Because, it's just the last straw. So any of you out there, if you have a knee or a hip that's so degenerated and you think you're waiting until you get older, because at least I'll get 10 more years out of it, bad choice. Because your bones are going to have less bone density, your muscles are going to be less likely to be able to support you, and you'll have so much atrophy and bone density loss that the artificial knee or hip may not even, the bone may not even be solid enough for it. So if you can't squat, then what happens? You get a lot of stagnation in the vascular, into the pooling of blood down into your lower extremities, and there are all kinds of bad things that happen. One of the measurements, and there have been lots of measurements on length of life and morbidity and mortality done with squats and grip strength. Squats, if you're squatting, that means your ankles are flexible. Ankles are flexible, you can take a longer stride. If you can take a longer stride, you're going to pump more blood from the lower extremity back to the heart. Loss of grip strength, all kinds of studies done on your risk of dying as your grip strength goes down. Well, think about it. There's some emergency situations where you have to grab onto something to prevent yourself from falling. And if you can't do that, or protecting yourself from somebody, you can't grip, then it might go south on you pretty quick. So squatting, that's why David Schmidt talks about that. The very big measurement that you want to make sure that you maintain, or the ability to do that.
Yeah. Really heels of that. Wouldn't you say it's my experience that at X49, my experience, guys, not clinical study, that it really helps decrease the atrophy rate, in my experience, 50 to 75%, and also helps build the muscle. So would that not be a great application as well to help us get stronger?
Absolutely. And that's one thing that I've noticed as well is, I've been trying to build muscle for a long time. And the older I got, my next birthday is 70 in a few months. The older I got, the harder it got to maintain, much less to build. But I've actually been able to build muscle using this. And everything else stays the same. Not taking steroids.
Exactly. Someone asked,
I've seen Arnold's body after taking steroids his whole life.
yeah, oh my gracious. Somebody was asking about, in stopping a particular statin drug, do you need to wean it off? And I'm just going to say, guys, if you're on, and I'm presume you could say the same thing, John, is if you're on a medication, talk to your physician.
Absolutely.
You want to change it or wean off of it. That's a conversation you need to have between you and your physician.
It is. And never, ever, ever just go cold turkey off of anything, because your body its operating system, so to speak, is included. It includes that statin drug. So now you stop taking that, the whole system is off. Same as I tell people, we talk to people about that all day in my bricks and mortar practice, Claremont, Idaho, where we help people with brain things. We tell, our common goal has to get people off of these, but you have to do it slowly.
Yep.
Anything you're taking.
Yeah. Thank you. Another point within the chat was, can you also touch on irregular heart rate? Now you kind of did a little bit with your particular irregular heart rate. Funny thing, I had the same experience. I mean, in the way of when I started adding, I add more than one patch of, like more than one X39. And I noticed that sometimes I get my heart palpitations going really fast, slow, et cetera. And then now it's gone again. But anything else you want to address when it comes to irregular?
Yes, I do. As a matter of fact, very important, probably even for somebody, excuse me, some people on this call. If you had a situation like this, you lie down at night, your heart rate shoots up, or you start getting a fluttery heart, you probably don't have any, you might not have anything. I went blurry for there, didn't I?
You did.
Maybe I better sit down after drinking. I'm getting blurry. There we go. Now I'm back in focus. So you could, there's a syndrome. It's called gastric cardiac syndrome. For people who have been frustrated because they have all these weird heart symptoms, and they go and they have the stress echo and they have this and that. And the doctor says, yeah, there's nothing wrong with your heart. It's so frustrating because people get misdiagnosed. What it is, you have some dysbiotic bacteria in your stomach, small intestine. You can have SIBO, small intestinal bacterial overgrowth, but it ferments something that you're eating, or it could be candida that ferments sugar. And so you have the production of this carbon dioxide gas, and it fills your stomach up so tightly that it pushes up. It's called the fundus, or the top of the stomach. It pushes it up, traps the vagus nerve between the diaphragm and the top of the stomach, where the vagus nerve attaches. So now somebody has all kinds of issues, and they go to the doctor and they say, no, nothing's wrong with your heart. No, nothing's wrong with your heart. You could get symptoms of asthma, symptoms of cardiovascular disease, gastrointestinal problems. It's called silent GERD because you don't have the typical GERD, but people report they burp a lot. They feel like they have to burp. I was burping. And so look up Romheld syndrome, ROEMHELD, Romheld syndrome. It can be life-changing for you if you are one of these people. You lie down, your heart flutters, it races, you got to get up. So when you lie down, there's more pressure on that nerve, on the vagus nerve, than when you're standing, obviously, because gravity pulls things down, and you lie down, and it kind of creeps up and traps the vagus nerve attachment on the stomach is on the top, called the fundus. And so it traps your vagus nerve. So if you already have issues with sympathetic freeze, that's when you're stuck in this fight or flight. And now you put pressure on the vagus nerve. There's more dominance in your fight. You could have anxiety and depression and heart palpitations and heart racing and all of that stuff. And it really doesn't have anything to do with anything else other than that pressure on the vagus nerve. Romheld, ROEMHELD. gastric cardiac syndrome. What was the original question? Sorry.
No, it was just about irregular heart rate.
Okay. Yeah, you can have you can have something organically wrong with the heart. But these people who have this Romeheld syndrome, they'll go to the doctor and they'll have all these tests and say, nope, nothing's wrong with your heart. Well, I know there's something wrong with my heart. It skips a beat. It does this. It races at night when I lie down and I have to get up. And so that gets to be really frustrating because nobody listens to them because nobody knows about it. Go to the doctor and they don't even tell you about it.
I imagine we're probably seeing, and you can let me know, because I know you see a lot more clients than I do, but I know I've seen a lot more clients who have a lot more anxiety, are extremely sensitive to noise, stimulus, et cetera, because we have had, so many external events that are constantly put us on high alert. We all have a little PTSD, keeping that vagus nerve constantly charged. So we're going to see a lot more issues coming along that down that pike as well, correct?
Yeah, that's actually the focus of my practice. It's giving people balance between their fight or flight and rest digest, the sympathetic, parasympathetic. When somebody asks a question about POTS, which is POTS, positional orthostatic tachycardia syndrome, that's when your parasympathetic nervous system is so inhibited that your blood pressure sensors can't sense blood pressure. So when I have blood pressure sensors right here in the carotid artery, the carotid sinus. That's one of the things I test for when somebody comes into my office. So when you stand up, you can't maintain your blood pressure, so your heart rate shoots through the roof, and a lot of people will pass out. That's one of the things we test. That's part of being in sympathetic freeze. Once you know that the sympathetic and parasympathetic have a teeter-totter relationship, neurologically, it must be so. If one goes up, the other goes down. So if you're dominant in fight or flight, it means your parasympathetic is being inhibited or held down by an overactive fight or flight. That includes blood pressure regulation. It includes pupillary dilation. So if you're stuck in fight or flight, your pupils are dilated, and people go outside and they always need sunglasses because there's too much light getting in. Those are things that I do. I mean, they can be tested elsewhere, but that's actually my whole focus is getting that balance back in the autonomic nervous system.
Well, I can just see now I'm going to go ahead and shoot you up for maybe in about 6 weeks or so to come on here and talk about that very topic. Because I mean, I have, somebody talk about just the vagus nerve a couple months ago, but I mean, to really take this topic and go down deep and what people can do to calm that and balance the two out and calm that whole system down, because it has been, we've had constant stimulus for 3 years, and we need to breathe that one down. So I would love, and I'm sure everybody would love to have you back to talk on that.
Sure. That'd be fun.
Yeah, because I think that's a very, very important one. So we kind of got off track, guys, but nevertheless, the parasympathetic sympathetic system can affect the heart. And that's other reasons might lead to heart issues, correct?
Yes, absolutely. So if it's the heart, you can have something wrong with the heart, or you can have pressure on your vagus nerve. The vagus nerve controls heart and lungs. So you could have whatever's on the end of your vagus nerve affected if there's pressure on that nerve. And that's what that Romeheld syndrome is. Gastric cardiac syndrome. It feels like and sounds like you have cardiovascular issues, but it's not that. You have pressure on that nerve. You can still have problems with the heart, but I mean, they're not mutually exclusive. You could have both. But people you go to the doctor and the doctor says there's nothing organically wrong with your heart. It's frustrating.
Yeah.
Multiple diagnoses, and then you have nothing.
Yep. I'm going to dive into one thing that's normally not spoken about, but if I don't, I won't be honoring my path. And I know you and I kind of connect on this. Here we talked about heart health when it came to, physical applications, what's going on with the physiology, what products within LifeWave would definitely help and why they help. We didn't really touch on food sources, but that'll be another topic perhaps for another day. You talked about the sympathetic system, vagus nerve, et cetera, et cetera. So, you know, in history, and I don't know what the latest statistics are, that mainly men, and I'm going to be a little bit overgeneralizing here, so forgive me, folks, but mainly men are the highest with heart disease. Is that still correct?
You
Or is
know,
it balancing out a little bit?
I've heard both.
Yeah. Okay. So kind of balancing out. But from my training and my experience, that a lot of that is due to we're a lot in the mental head and we're not so much in the feeling of the love of the self. That's where I kind of wanted to go here for a little bit, because I know you and I do kind of overlap with, the energetic and emotional body of loving the self. And I know it's been through, I know my father was like, nope, shut off those emotions, nope, just, complete in a mental body. This is all we're at. And, during back in the 70s, 80s, you saw a lot of men just, having a lot of heart issues because. What is your opinion or your thoughts backing that, or, talking about the emotional and mental aspects?
Yeah, it's all about balance and all about, when you understand we are emotional beings, and if we suppress that, it's going to be stored somewhere. Um, I have it's called a bioharmonic resonator. It's a bed. It has transducers in the bed. It's an ergonomic bed. You listen to the music, but also you're feeling the frequencies in your body. And I say it helps get tissues out of the tissues. We have false memories that are stored in our body. And so if you lock or deny yourself the feeling and expressing those emotions, then they get stuffed and they'll come out someday. We have people end up in my office a lot because of things like that. I wasn't allowed to do this, or my dad told me to be tough, don't cry, be a big boy. That's not helpful, needless to say. So yeah, and then people will be going through treatment in my office, and all of a sudden they'll remember things that happened when they were a kid that they had forgotten about because they stuffed it. And I always say, you know what? As that thing's coming out, it's flipping you the bird as it's leaving your body. So see ya, just say, see you later. You're not welcome here anymore. But sometimes, as you're trying to experience more emotions, you will actually go back and re-experience that thing that you stuffed away. Like one of my granddaughters, it was their daddy that was murdered. They were identical twins. And one of them went into, I'm fine. I don't feel anything. Because she tried to block it all so that she couldn't connect with people. She didn't feel emotions. She was just the same, always the same. And didn't have very many friends. Absolutely gorgeous girl, but didn't have friends. So, it's really emotionally rewarding to me to help bring her out of that with the things that's why I do what I do. That was the main reason I went into what I do, is because of that event. There were three of them in a 3-year period. And I said, you know what? I'm the dad. I'm going to go fix stuff. Give me a wrench. My wrench was the treatments that we do.
Oh, that is awesome. Thank goodness that they had you. And thank you very much for addressing that, because I see all the time in my practice of the blocking off of emotions and not accepting oneself and knowing they're enough and they are lovable and they are loved really causes a lot more problems with the heart. So thank you. Someone wanted to know if you could re-mention what kind of bed it was that you used.
Oh, it's called the Vibe. It's a bioharmonic resonator, and I'm trying to think of the company that made it. It'll come to me in a minute. I could put it in the chat, or maybe I can look it up right now. It has been the first time I did it. It was at a conference called the Cell Core Conference, and it was 3 days long, and it was packed. Every time I'd go out at break, and everybody's, 10 people deep for waiting. And then the last day, there was only one person. So okay, I'm going to get in line. And I laid down on the bed, and she said, what protocol do you want? And I said, I don't know. Gave me a list, and there was this one. It was called building your vision board. I go, okay, I'll take that one. the freaking thing, I couldn't feel my clothes on me. I was like an out of body experience.
Yeah.
And the weirdest thing, and it was all about vision board. I, I don't even know where it came from. But it's going, where's your 600 million idea? 600 million, 600 million, 600 million. I'm going, oh,
No
take it
way.
easy, fella. But what's really fascinating is from that session that I had, very quickly, I went into writing the book, getting it published, and got on different shows, talked to Tom Cowan show and all this stuff. And I thought, maybe that played a role in that. Because, I started doing it in my office. I got up and I said, okay, I'll take one of those. And now I have it as part of our protocols. So we do stuff with the brain, we do microcurrent neurofeedback and laser therapy, and then we have the bioharmonic resonator to balance out that autonomic nervous system.
Yeah. And everybody, if you have a question, start either uploading into the chat or raise your hand and you can ask Dr. Jon Harmon that question directly. As you also see in the chat, thank you very much, Jenny. Dr. Jon Harmon has written a book just recently, has been released, How to Reverse Aging. And she's also, I believe, put the link there as to how to, is it in, it looks like an Amazon thing. Is it Amazon now?
It's on Amazon, yeah.
Okay, so you can go ahead
It
and
has been since August.
Okay, so you can go ahead and contact, you can get the book there, very good book. And while I have this moment, because you'd get a segue, our next week's personal development and training is going to be with, supposedly currently right now it's planned with Laura Balzer, and she's going to be talking about the vision board. So good segue there.
That's awesome. So it's called Bioharmonic Technologies.
Okay.
Yeah. If that doesn't get you there, you can.
So yeah, someone put in a bioharmonic resonator, same thing or no?
Yeah, that's what it's called. Gosh, I wish I had more information for you right now, but I can get it.
Yeah, there's a lot of really great products that are coming out, like the sound bed.
Bioharmonic Technologies.
Okay.
Interestingly enough, through that whole thing, I sponsored the owner.
How does that differ from the Beamer? Are you aware of what the Beamer does?
Yeah.
Okay.
Yeah, it's different in that it doesn't put anything into you. You have headphones on, and there are transducers in the bed that convert the music to vibration. And it's specifically written, he's an expert on frequencies. Which frequencies affect beneficially the heart, the muscles, the pineal gland, whatever tissue it is, whatever organ. And so there are different things like cell cleansing. There, different programs for different things.
So it's kind of like so similar to that of like LifeWave of supporting the body with sound and frequency, so the body can do what's right for it.
Right. So if anyone's interested, you could reach out to me, and I can hook you up with Steve. He's the owner.
I don't know if we want to go into this. It's up to, there's a lot of questions. Now there's a lot of questions about beds. What do you know about your body shaper, the whole body vibration, med beds, etc.? I think that's another discussion perhaps for another day.
Yeah.
Yeah.
I have to be.
Yeah.
I don't have time. But I'd love to do that another time. That would be great.
Yeah, exactly. All right. So if there's no last conversation or questions that anybody would like to ask, I want to be respectful to Dr. Jon Harmon, to his time. It's been an hour now. If any last questions, going once, going twice. Any last thoughts, Jon?
Get patched up.
There you go.
The most brilliant biohack I've ever heard of. And, talk about simplicity, energy we're making.
Yep. So the top patches I heard you recommend, X39, of course, we're there, we stay there, we're always there. Carnosine to help the tissue repair and many other things. X49 to help the muscle improve, recover, strengthen. Any other thoughts with any other particular products?
The Aeon patch activates parasympathetic nervous system.
There you go.
That would be good.
So I love 4. I love 4.
Yeah.
Thank you so very much, Jon. I really appreciate you being here with me today. And literally, I'm going to let me know what's good for your schedule. And 6 to 8 weeks from now, we can get you in here about the parasympathetic and sympathetic nervous system. I think it's a really good.
Awesome. That would be great. Thanks a lot. It was a lot of
All
fun. I enjoyed sharing this hour with you.
Thank you so much.
You're welcome.
Take care.
Bye-bye.